focusing on leadership issues in the context of human resources health development. I'm being requested by Dr. Singhi to focus my talk on addressing global HRH challenges through leadership development. And I planned this talk as giving you some glimpses about the global scenario and background for the human resource for health, then bringing and shifting the focus to the leadership development in the context of human resources for health, taking some few case studies from India, and then finally concluding that how and why it is critical and important to talk about leadership development, not only in the context of generally about the health systems focus, but specifically focusing about human resources health development. We all agree and know that the health systems are crux in designing, implementing and monitoring health programs and delivering quality health services. And for that, we require and need a strong and vibrant health system. But such systems are impossible unless we talk about the health workers who are the critical backbone of the health systems. This framework is very familiar to all of us. I don't think that we should deliberate too much on this. But it's important to understand the two building blocks clearly reflected here. One is about the health workforce, and second is about the leadership and governance. These two building blocks, in addition to other building blocks which are reflected here, are very critical in actually strengthening the health systems, which is quite well reflected in WHO Health Systems Framework. We need to see that how do we link and engage leadership, empowerment as a part of the human resource health development globally. If we try to analyze the challenges in a global context, at what are the global HRH challenges, health workforce shortage that most of the countries globally are experiencing, skill mix imbalance, maldistribution and migration, negative work environments, and weak knowledge base. We still struggle with the data on HRH in several countries for planning and policy purpose. We still quote this WHO report 2006, which reported critical shortage of health workers in more than 50 countries. And more than 4 million workers are reported to be deficient globally. And we all also know that it would be very difficult for us to march the agenda of universal health coverage unless we improve the situation of health workforce, not only in individual countries, but thereby contributing in regional deficits and global deficits. This is very much reflected in a simple message that health workers save lives. We all know that the density of the health workers has been strongly correlated with the probability of survival. And we could very well say that where the density was high, density is high, the maternal survival, child survival, including the infant and neonatal survival is far better. However, there is no strong indication that HRH crisis has been significantly reduced even today. Even if you look at the numbers of 2006, the latest numbers not holistically available, but in last 5 to 6 years, nothing has improved, means improvement has not been that significant actually. Hence, we need to think innovatively, strategically. How do we actually respond to these challenges? A lot of contemplation has gone into in last 10 years, 15 years on health workforce development front. But the time has come to understand what are the critical drivers which drives the health workforce development globally and individual countries. In that context, what could be the strategies, what could be the innovative ways that one can think about it? Because we all appreciate that appropriate and effective health workforce strategies can certainly enhance the performance of the health systems and would result into better health outcomes. This is HRH action framework, which is quite familiar to us. And if you look at the HR human resource management systems, it talks about the 5 key drivers: leadership, policy, finance, education, and partnership. I specifically wanted to mention here, leadership should not be seen in isolation. Leadership should be seen as a cross-cutting driver. Even if you take an example of a policy, without leadership being demonstrated, you can't engage yourself into the policy. You take an example of finance, unless you have a critical role of leadership being there, you can't handle finances, education, partnerships. So leadership is not only an independent building block or independent driver of the human workforce development, but it is a very cross-cutting driver in the context of providing the health support in development in the HRH scenario. And that would contribute to the critical success factors, finally improving the health scenario, workforce scenario, and thereby contributing to the better health outcomes. So in that context, leadership plays very critical and important role. But the way this HRH framework has conceptualized, it conceptualizes leadership as the capacity to provide direction. Every word is important. Provide direction, align people, mobilize resources, and reach goals. That's how it has been conceptualized in this particular framework, the whole philosophy of leadership. But then why leadership development? Why are we talking about leadership development in the context of human resources for health? Because we realize, we know that there is a leadership vacuum in critical HRH areas globally and in individual countries. HRH information systems, we still don't have data. I come from India. We really do not have the latest figures available at even national level, state level about the HRH scenario. We really do not understand the overall dynamics and supply and need and requirement even today. A lot of information gaps. Research capacity in human resources for health. There is a strong need of identifying research gaps in HRH. And there is a leadership vacuum globally in India, in other countries also, that we need to see that how do we build a research capacity and research leadership in individual countries to take the challenges of addressing research gaps and finding solutions appropriately. Designing and implementing policies. Capacity building initiatives, common platforms. Where are the common platforms? We're happy that this AAAH is one of the common platforms. We need national level common platform where we discuss, debate and deliberate on critical challenges of HRH on individual country level. Communication gaps between ministries, Ministry of Education and Ministry of Health. Between key stakeholders, supply side and demand side, looking at the health systems and education systems. There's a tremendous gaps. Councils do not speak to each other. Nursing council, medical council, the council for alarm, they don't talk to each other. A lot of communication gap, leadership vacuum there actually. Holistic perspective, we need to see that how do we actually address these. These are all fragmented HRH issues. But we need to see holistically how do we actually address the challenges of leadership vacuum which could address in responding to the HRH challenges. And we also need to understand that workforce development is not merely technical process. It's not technical process. It basically demands building a very strong action coalition across all stakeholders, beyond governments, beyond sectors. That needs to be looked at. And therefore it demands an urgent, exceptional, multidimensional and inclusive response. And therefore it calls for a strong leadership. That's the reason that we talk about there is a strong leadership. But then what leadership is all about? When we say that leadership in the context of even HRH and health systems, what is all is about? We need champions. These all have been champions in their field. We need champions in HRH at global level, at